Good afternoon. My name is Sherry Bailey. Today I'm going to be doing my final assessment for 499. A professional development plan is something that outlines the required skills, competency, goals, and objectives that a staff member or student needs to accomplish in order to show continuous improvement and career development. Basically, these are goals that need to be accomplished in order to show professional improvement. These are goals that you can make for yourself or that someone else can make for you. Program learning outcomes are outcomes that will be met by the end of the program. These are used to show the learner what will be learned or accomplished by the end of the program. If these program learning outcomes were not met, then something in the program was either lacking or the learner was not successful in the program. The BSN program I'm about to complete had a list of these program learning outcomes that I have learned and utilized during my time in this program. The purpose of this presentation is to discuss these outcomes and demonstrate how they have bettered me as a nurse in my professional career. The first learning outcome that I will discuss is how I have learned to assume a leadership role in a multidisciplinary teams within my healthcare organization. In some instances, it is necessary for someone to assume that leadership role. This program has helped me to do this by teaching me what is expected from the leader when you're the one that assumes that role. Working in a hospital, you often have to work with multidisciplinary teams. The first tactic I have utilized is my communication skills. Communication skills can help in many different ways. However, when dealing with people, like difficult people, or different people in different roles, and everyone has different personalities, it can definitely help you then. Knowing how to talk to people can definitely help you be able to understand them and communicate with them in a way that is therapeutic. When you're dealing with so many different people and personalities, not everyone is going to agree on everything. So being able to listen and communicate are two crucial things that you have to be able to do. And this program has definitely helped me build on those skills. If you listen appropriately to people, you're able to come up with creative solutions and ways to compromise that can definitely benefit you in your entire career. The next important thing that I have learned is how evidence-based practice and research can alter your practice. The program has taught me that using evidence-based research to shape your nursing practice can greatly benefit the patient and can lead to better patient outcomes. You can also use evidence-based research to create new policies and better safety procedures to help other nurses strengthen their nursing career as well. Evidence-based practice should be utilized by all members of the multidisciplinary team, and if it is not, we, as nurses, are responsible for being the voice for our patients and identifying when a situation is unsafe or not best practice. When the nurse identifies these situations, they can then use that research to provide education and hopefully change policies for the future. As a nurse, you have to be able to use research and critical thinking to assign nursing diagnoses. It is important to prioritize those diagnoses from highest concern to lowest. Using evidence-based practice can sometimes help with identifying the nursing diagnosis that is of most concern when evaluating patients and assigning those diagnoses. A nursing diagnosis can be very important because it helps the nurse and other nurses to identify the patient's biggest health priority. The nurse can then go on and address the highest concern and educate as needed. Being that nurses are the patient's advocate, nursing diagnosis can be a good way for nurses to identify the biggest concern for the patient, like we just said. And at times, nurses are able to identify those concerns before physicians are. So if this is the case, it's the nurse's job to report those concerns. Research and evidence-based practice can help the nurse feel more educated when reporting and noticing patient concerns. In this program, another thing I have learned is how to design care plans for individuals, groups, and communities. Design care and care plans. In many assignments we were instructed to come up with a group or community care plans. Knowing how to identify care plans for groups and communities is a valuable skill. If there is a certain aspect of health health education that is missing in the community or within a group, it's very important for a community health nurse to be able to identify and address that. I feel much more qualified as a nurse to be able to identify and address these things now that I have basically completed this program. There were many assignments, especially like in shadow health, in the case management class, the community health nurse class assignments that allowed me to practice with these nursing skills. Now that I've been able to practice and apply these skills, I do feel more equipped to better help educate individuals, groups, and the community as a whole. Another thing that I was taught in this course was ways to promote health promotion and education in nursing care. So how to combine that into your nursing care. This is something that we always do as nurses. Sometimes we don't even notice that we're doing it. And this program definitely helped me to expand on this skill. Using Sentinel City, we were able to look through the city and identify health issues. This has helped me to be able to identify health issues and educate in a community setting. Health promotion is a behavioral social science that draws from biological, environmental, psychological, physical, and medical sciences to promote health, prevent disease, disability, and premature death through education-driven voluntary behavior change activities. Health promotion in a community or among individuals is the process of educating people and groups on the best ways to promote health in a way that prevents disease. This can help in many settings as a nurse. In community settings, like I previously stated, in individual settings like in an office or something, that ways you can educate before the patient has to go to the hospital for those preventable diseases, or even in a hospital setting whenever you're trying to educate more about diabetes to prevent them from coming back from kidney issues or other diabetic like ulcers and stuff like that, complications from those diseases. As a nurse, we make mistakes. We're all human and it happens. It's important, however, to be able to accept accountability for those actions, especially when being accountable can mean the difference between life and death. Being able to admit mistakes and use professional judgment is a vital part of nursing. Professional judgment is needed on a daily basis in the form of like critical thinking. We use it when providing direct patient care, when dealing with difficult coworkers, or when confronted with just difficult situations in general. Being better prepared to handle difficult situations and accept accountability is one of the many ways that this program has also helped me. Another learning outcome that has been achieved is to integrate professional values and role behaviors. Having professional values is a big part of nursing in general, especially whenever you think about the severity of our job. Patient privacy, health, and well-being should be valued among all other things. This program has helped me bring those values to light. Demonstrating and living by those professional values is one way to exhibit role behavior. If other nurses see that I'm living by my values, they will in turn want to start living by their own values. Demonstrating professional behavior is necessary in all jobs, but especially in nursing. Another way that this program has helped me is by opening my eyes to problems of contemporary health. While working as a med-surg nurse, you see oftentimes that many people are homeless or they just don't have the means to pay for certain things and end up going without things like medications, physical therapy, any type of home health, things that they need, equipment, resources, anything like that, that could make a big difference in their care that they receive at home and, in the hospital. Lack of healthcare access or lack of resources to pay or receive the care that you need is a big issue for many people. The community health nursing class helps us to practice with noticing these types of issues and helps us to address these in a creative and helpful way. Being able to identify these contemporary problems with health and illness will help me in my future nursing career. We also learn what it means to become a global citizen in this program. Being a global citizen simply means believing that extreme poverty and all of its related symptoms and causes can be eliminated if people take action. This means that we, as nurses and people, must all play a role in this goal. Our job as global citizens is to do our best to assure that people have the basic necessities. Living by your values and fighting politically and ethically can help us to improve standards for all individuals. This global citizen definition really has a lot to do with the contemporary issues with healthcare as well. They kind of play a role together. Health policies are a huge part of healthcare, whether they're at the local level, the federal level. Nurses can help to shape those policies by getting involved. Nurses have the capability to collaborate with doctors, respiratory therapists, and many other members of the healthcare team to shape policies at all levels. One way to get involved is by joining groups at your local hospital or even at City Hall. In my hospital, for example, we have a group called the Shared Governance Committee that I am involved in that allows many ancillary members of the healthcare team to all come together and discuss problems or issues that have come up amongst each other, amongst other people, whatever it is. This can also be a time for praise as well, but typically we end up discussing issues. The members can work together to find a solution via a policy change or just something creative that can help the flow of care. It is the same on a community and federal level. You just have to get involved in different ways that way. We can play a big role in shaping the lives of our community just by getting involved. When looking back at goals that I had set in the beginning of the program, I had 3 short-term and 3 long-term goals. My short-term goals included getting my NRP certification, getting my ACLS certification, and getting my STABLE certification. I have achieved 2 of those 3 goals. I got my ACLS certification in April and my NRP in May. So I do consider that a success, especially with all of the craziness of COVID going on. A lot of classes were canceled or pushed back or just postponed. So the STABLE certification never happened, but I'm still lucky and thankful that I was able to get the other 2. My long-term goals included receiving my BSN, becoming an RN3 at my facility, and climbing the ladder and one day becoming a director. I am about to finish with my BSN, so that is definitely accomplished. The next goal will be the becoming an RN3 at my facility, will take me about another year because in order to become an RN3, I need at least 2 years in my of experience in my specialized skill. Right now I only have 1, so I need another year for that. And my third goal I have actually changed because I decided I wanted to do something different. I've decided to, instead of becoming a director, continue my education, and my goal is to be an FNP. So overall, I do feel very happy with my goals, and I do feel successful in what I've achieved. I do believe, in general, I've learned a lot through this program. It has made me think of things that before being in it, I may never have thought of before. It's definitely opened my mind to a new side of nursing that I never really saw. The community health nursing side, the case management side, a lot of things. And I do think Sentinel City plays a good role in helping you see different sides to nursing. I think the Shadow Health program, that kind of shows you a clinic setting. Another thing that a lot of times, especially me, a young nurse who has never worked in a clinic, I've never seen that before. So that was really vital in seeing that different side of patients and being able to work with and play with in a simulation that's something we can control. And I am very grateful and blessed to have been a part of it and be able to finish with my BSN.